This is Module 2, Chapter 9, Evaluation and Discipline. Please review this section and complete the assignment with a minimum score of 80%.
In this chapter, we will discuss the purposes of evaluations, the role of documentation and record keeping for evaluations and discipline, and describe methods of positive discipline. Evaluation and discipline are essential components of an EMS provider's development. The EMS officer plays a key role in developing EMS provider success. The EMS officer conducts regular evaluations of job performance, behavior, and problem resolution. Positive discipline is intended to help the employee recognize problems and make corrections to improve performance or behavior. Negative discipline is intended as punishment for unsatisfactory performance, unacceptable behavior, or failure to respond appropriately to positive discipline. Discipline should be progressive, moving from positive to negative and from minor to major. Some problems are so serious that the earlier steps in progressive discipline might be bypassed in favor of a more severe and appropriate punishment. The EMS officer conducts regular evaluations of personnel and their performance. These evaluations help to ensure each EMS provider knows what is expected of him or her and helps the EMS provider know where he or she stands relative to expectations. The evaluation process helps the EMS provider set personal goals for professional development and performance improvement. It also provides positive motivation to perform at the highest level possible. Many career EMS agencies require a supervisor to conduct an annual performance evaluation for assigned personnel every year. In volunteer departments, the procedure may be less structured. However, all personnel deserve evaluations of their performance. The EMS officer has a special responsibility when starting an evaluation process with a new provider because the officer is actually helping to shape that individual's career. It is the EMS officer's responsibility to determine each individual's skills, knowledge, aptitude, strengths, and weaknesses, and then set appropriate expectations. The probationary EMS provider is expected to obtain certain experiences and demonstrate competencies through a field training or precepting program. This probationary period requires the EMS officer to provide regular evaluations. Performance evaluations should be a continual process. Feedback on individual performance is most effective when delivered as soon as possible after an action or incident. This means providing feedback at the hospital before the patient care report is completed. The EMS provider is intensely aware of the events surrounding patient care and wants to know how well he or she has performed. The EMS officer needs to be ready to provide specific information to recognize or help improve that EMS provider's performance. Discipline is a moral, mental, and physical state in which all ranks respond to the will of the leader. The EMS officer builds discipline by training to meet performance standards, using rewards and punishments judiciously, instilling confidence in and building trust among team leaders, and creating a knowledgeable collective will. Discipline is divided into positive and negative. Positive discipline is based on encouraging and reinforcing appropriate behavior and desirable performance. Negative discipline is based on punishing inappropriate behavior or unacceptable performance. Positive discipline is directed toward motivating individuals and groups to meet or exceed expectations. The EMS officer provides positive discipline by identifying weaknesses, setting goals and objectives to improve performance, and providing the capability to meet those targets. Positive discipline is reinforced by recognizing improved performance and rewarding excellent performance. If a provider's performance needs improvement in a particular area, the EMS officer should coach the provider, giving guidance and extra opportunities to correct the problem. The officer sets the stage for positive discipline by setting clear expectations and by walking the talk. EMS officers are working supervisors. That is, they supervise while directly participating in EMS activities and performing non-emergency duties. The EMS officer should demonstrate a personal commitment to the agency's goals, objectives, programs, rules, and regulations. Empowerment is one of the most effective strategies within the realm of positive discipline. The EMS officer aids personnel in learning more about how the EMS agency and the local government work together. The EMS officer should help providers locate tools to help them achieve success. An officer who identifies an area where improvement is needed can often empower a provider to correct the problems on their own. An oral reprimand, warning, or admonishment is the first level of negative discipline, considered informal by many agencies, usually stays with the officer and does not become a part of official personnel records. In most situations, these actions will suffice to correct the behavior. As a part of this process, the officer must determine whether the provider is unable to meet the required performance, which will require additional focused training, or, if unwilling to perform, will start the fact-finding process. Some EMS agencies require the EMS officer to use a standard form when issuing an oral reprimand, warning, or admonishment. The form ensures that the EMS officer covers all of the requirements of an informal reprimand. The form also allows the EMS provider to understand that this is a disciplinary issue and to have an opportunity to respond. Agency policies usually require all of the official personnel records and work history to be in a secured central repository. The file typically includes the hiring packet, such as application, candidate physical agility tests, test scores, and medical exams, their tax withholding, I-9 status, and insurance forms. Personnel actions such as promotions, increase or decrease in pay, evaluation reports, grievances, and formal discipline documents are also included. Supervision of EMS personnel requires that the EMS officer conduct regular evaluations to provide feedback on the job performance, their on-duty behavior, and problem resolution. Provider evaluation should be an ongoing process throughout the year. The annual performance evaluation is a formal written documentation of the provider's performance during the year. The EMS officer must determine each new provider's skills, knowledge, aptitude, strengths, and weaknesses, and then set specific appropriate expectations for every new provider. Regular feedback from the EMS officer should keep providers aware of how they're doing, particularly after incidents or activities that presented a special challenge. The EMS officer builds discipline by training to meet performance standards, using rewards and punishments judiciously, instilling confidence in and building trust among team members, and creating a knowledgeable collective will for the team. Positive discipline is directed toward motivating individuals and groups to meet or exceed expectations. Agency policies usually require all of the official records of personnel work history to be in a secured central repository.